welcome back to your own YouTube channel Ask Your Gynaecologist. I am Dr. Sonal Parihar. As usual, I am back with a topic which has been requested by you all. Okay, so today's topic is VBAC, that is vaginal birth after cesarean. Okay, so before we start this topic, I would just tell you that DocWise app is working very well. This is the DocWise app that I'm just talking about. You can download it on your mobile Play Store. This is my PIN, so you can connect with me directly. And now it is operational even in the international countries. I mean outside India, the patients are sitting outside India, they can also connect with me through this app. Very soon we are going to start calling you through this DocWise app, because right now only the Indian numbers are available for calling. So if you put a call request, then I can easily call you through this app. Okay, very soon it will be available for the international patients as well. So if you have any technical queries, you can always dial this number or WhatsApp this number. If you want to come and visit me in my hospital, I am in Rajasthan, Jodhpur. This is my address, and this is the secretary's number who deals with all this, all the appointments. Please call her between 10 to 8. Okay, the lines are open from 10 to 8. Now, there are other portals like Facebook pages, Instagram and Twitter. I give you this so that you can follow me there. And in case you have any query and you feel that you cannot get your answer on YouTube, or you cannot operate YouTube, they can put your question here. And somebody, either me or my secretary or my PR person, will actually read the question and forward it to me. So if I think it is answerable on YouTube as a public question, then I will definitely answer. Otherwise, I'll respond there itself. Okay. So coming to the topic, VBAC, that is vaginal birth after cesarean. So everybody wants a vaginal delivery. Everybody wants a natural birth. Nobody actually likes to have a cesarean, unless there are some subset of patients who actually opt for cesarean because they cannot go through that nightmare, the pain, and probably they don't want their vagina to be loose or whatever reason. A very small subset of patients, they actually opt for cesarean. But otherwise, everybody wants a normal delivery. So what is the problem that we face after cesarean? Why vaginal birth is so difficult after cesarean? Well, number one, the pain threshold, the pain intensity is much more as compared to a pain in which you have had as compared to a patient who has had a previous normal delivery. Now, I am saying this because practically I have seen patients telling me this. Initially, we used to think that probably because a patient has never had a normal delivery, so she's probably overreacting because the previous baby was cesarean. But I have seen patients telling me that even if they've had 2 children before, one was a normal delivery, other one was a cesarean, third one is very painful after cesarean, probably because that particular area of the uterus is weak. Probably because other structures near the uterus have gone adherent, they kind of gone, there are adhesions there. So because of that, when the uterus expands and the pain starts, the pain is much more as compared to a patient who has never had a scarred uterus. Okay. Secondly, sometimes the time is longer as compared to a patient who has had a normal delivery before, because this is the first time her uterus, her bones, her tissues are relaxing for a normal delivery. So the time will be more. This patient is more prone to have an instrumental delivery, probably because towards the end the patient is tired, because of the excessive pain, because of the long labor. Probably sometimes the babies do not kind of adjust themselves, their diameter, the head which needs adjustment to come out. So all of that predisposes the patient to have an instrumental delivery. Okay. Another problem that we face in a vaginal birth after cesarean is such patients probably may not have a favorable cervix. A favorable cervix means the mouth of the uterus sometimes doesn't open towards the end of 9th month. Now, if in case a patient is there who has never had a scarred uterus, has never had a cesarean, we've got many options. We can put vaginal gels, vaginal creams, vaginal tablets. There are many prostaglandins available in the market which open up the uterus, which open up the cervix and induce pain, and then we can give some injections to increase the pain. All these options are not available, or probably are risky for a patient who has had a cesarean before. So the number of options are less. So in case this patient crosses her 40 weeks, her due date has come and still the cervix is not favorable, it is not opening up, not even one finger, then it is difficult, because in such cases we do not have much options. So we cannot really wait. We can probably just wait for a couple of days. That's it. Okay. And the last most important complication is uterine rupture. Rupture means dehiscence. It means the wall of the uterus has given away. So the fetus the baby is expelled in the abdomen. Now there are 2 types of ruptures. One is complete rupture, in which the baby comes in the abdominal cavity, and second is when the upper layer the third layer of the uterus, which is the outside layer, is still intact. So the baby is still inside the uterus, but the walls have gone. The endometrium, the myometrium and the serosa, these are the three layers. So the endometrium and the myometrium have given away. The muscular part has gone. It is only the peritoneal covering. So the baby is not exactly expelled in the abdomen, but it is still not getting the enough blood supply which normally comes from the uterus because of the rupture. Okay, so that is a very serious condition and that needs to be dealt with. That is why I've made this video, but it is a very vast topic because uterine ruptures do not always occur during delivery. They might happen before that. So I'll be making a separate video on that why uterine ruptures occur and what to do about that. Okay, now talking about VBAC, what happens if suppose the doctor tells you and the doctor has diagnosed that the uterus has ruptured? Well, there are again two types of conditions. One is a silent rupture. Silent rupture means the doctor didn't come to know, probably the baby delivers and after that something might just indicate that the uterine wall is not contracting well. Probably the doctor can feel it vaginally if we examine the scar, or sometimes abdominally we can feel it's very thin, we can feel that probably the scar has given away. Then the patient, if she's bleeding, she will probably need a surgery. Okay, surgery in the form of repair, because sometimes only the scar ruptures, sometimes the entire uterus ruptures. It all depends which part of the uterus is the weakest at that time. Generally the scar is the weakest, so that is why I call it scar dehiscence, in case the scar gives away. But sometimes if the other part of the uterus, say fundus or left or right wall or the posterior wall, if that is weak, then that might rupture. And if the rupture is very bad, then sometimes the patient might need hysterectomy as well. Right? Now coming to ultrasound. Ultrasound is not very reliable in diagnosing scar thickness. I have had many patients coming to me. Just last month a patient came to me in the 5th month telling me that the ultrasoundologist, the sonologist has told her that your uterus has ruptured at 5 months. The uterus has ruptured and the baby is inside your abdominal cavity. Go get a cesarean done, this baby will not survive. It was very difficult at that time because clinically when I felt the abdomen, I did not feel that the uterus has ruptured. Okay, so I sent it to another sonologist and he said that it's absolutely fine. So it's very fallacious because it's very difficult to diagnose. Sonography is just, I can say it is just ultrasound waves going inside the abdomen and just catching some images in black and white. Okay, so it exactly doesn't tell you that the scar has ruptured or the scar is very weak, because sometimes patients ask me, my scar thickness is only this much, what to do? Well, it is very difficult. It is all clinical. If the patient is bleeding after normal delivery, who has had a cesarean before, then obviously she will be examined per vaginally, and if really the doctor feels that she needs a repair, then she will be taken for an operation. But generally these things they repair on their own. They heal on their own. Okay, so there are two things that might happen when you rupture. Either you will have an emergency cesarean section and the uterine rupture will be repaired. Okay, or otherwise the other thing will be that if the uterus is bleeding very badly and the rupture is very bad, then the baby will be taken out and then the uterus will be completely removed. You might end up having a subtotal hysterectomy. Okay. Now, how many cesareans can happen, or in other words, when can you have a vaginal birth, after how many cesareans? That's a very common question. But again, there is no specific answer to this. Every country, every doctor follows their own protocols, because so many studies have happened, so many studies have come and gone. Nobody can exactly pinpoint. But I can just tell you that the chances of uterine rupture are just less than 1% in case there is just 1 or 2 cesareans. But when it comes to 4 cesareans, then the risk of rupture goes up to 2%. When it comes to 6 cesareans, it goes up to 6%. So it's like it's continuously increasing. So why do you want to put yourself under risk? So practically, if in my practice, I would suggest a patient go for a vaginal birth after 1 cesarean, because at that time I feel that the chances are very less as compared to a patient who has had 2 or 3 cesareans. I personally do not deliver patients after 2 cesareans because I've seen rupturing, I've seen silent scar ruptures, I've seen that sometimes you take a patient for a elective cesarean. You have not planned a vaginal delivery. She goes for a cesarean and there we see, when we open the abdomen, that the scar has already ruptured and the baby is almost outside the uterus. So that is why I do not allow my patients to go in normal delivery if they have had 2 cesareans. Okay, so the risk of rupture will keep on increasing, and it is advisable by the National Health Department, which actually advises us that they always tell that if a patient wants a bigger family, probably more than 2 or 3 children, she should be advised not to have a cesarean. she should not opt for cesarean, and she should try not to have a cesarean and talk to her doctor, because obviously if she has had one cesarean and she's planning 2, 3 or couple of more babies, then she will be in trouble. In case the patient just wants 1 or 2 deliveries, 1 or 2 babies, and she's happy with a small family, in that case she can take risk and she can go for a cesarean. Okay. Next question comes, how much gap should be there in between the cesareans or in between the deliveries? In case you've had a cesarean, technically the book says 6 months is enough for the uterus to heal. But practically I would say give yourself a gap of 2 years. Why? Because first of all, your uterus, your muscles, your body needs to be repaired well. Your baby is too small. After 6 months, you're still feeding the baby. So after 2 years, the baby will be good enough, big enough to start eating other things. You will have stopped breastfeeding by say 1 or 1.5 years, and then the baby will not be actually in your lap most of the time, because otherwise less than 2 years babies, they would like to cuddle and they would like to be in your lap, and then it will be very difficult for you to take care of that small baby and then take care of the baby which is inside you. So after 2 years the breastfeeding is stopped, you are healthy enough, your other baby, the first baby has grown up. So I would say give yourself 2 years gap, be healthy, eat healthy, and that should be it. Okay, so with the books, if you go with the books, 6 months is enough, but practically 2 years gap should be given. Next question comes, ma'am, how many cesareans can we go undergo? Well, if you look at the data, if you look at the prevalence of cesarean in different countries, there are 6 cesareans, there are 8 cesareans, 10 cesareans. Ladies can be very sturdy and very strong. They can undergo many cesareans. But as I said, your morbidity, your health, everything will be affected. The more you undergo cesarean, the more you undergo surgery, your health will not be as good as compared to when you've never had a surgery. Okay, so every time you undergo the knife, you go in the theatre, you will definitely lose some amount of your energy. Your body will not be the same what it was before. So I would advise, do not go for more than 2 or 3 cesareans. Okay, but technically there are patients who have gone through 5, 6 cesareans. Now what is the other complication that can happen? With cesareans, yes, the weakness will come, rupture chances will be there. The most important complication that you should be aware of is placenta accreta. Placenta accreta means the placenta is not just occupying the endometrium, the inner lining, but it has actually invaded in the myometrium. It has invaded in the myometrium means after delivery, whether it's a normal delivery or a cesarean, when the baby comes out, the placenta normally just comes out within 5 minutes. But such a placenta which is accreta has actually entered the uterine wall. This will not come out on its own. It will cause horrendous bleeding. Sometimes it has to be curated. Just like DNC, it has to be curated out. Sometimes we just leave it in because it is bleeding horrendously. We just give you anti-cancer drugs in the form of methotrexate for that placenta to if bits and pieces are left, we just want that placenta to get absorbed by itself. Otherwise, the third condition in which it is a very horrendous bleeding, we are not able to remove the placenta, the patient might need an emergency hysterectomy. So the uterus has to be removed. So that is again a very big complication of repeat cesareans. And if I tell you the risk, up till 3 cesareans, it is just 0.5% left. That is less than 1%. When it comes to 4 cesareans, the risk goes up to 2%. And when it comes to 6 cesareans, the risk goes up to 6%. So why do you want yourself to undergo all these problems? Why do you want to put yourself under risk? So please do not undergo many cesareans. I would say not more than 3. Okay. Another complication which I have already discussed in my previous video is low-lying placenta, that is placenta previa. I told you that these placentae, normally they migrate up in the fundus after 5th month. But a placenta which is stuck to the scar, especially if the patient has had a cesarean and the placenta is anterior, it is sticking to that particular scarred area, it has a tendency to stay there without going up. Okay, so that is another complication that you should be aware of. Okay. Another question that patients ask me, ma'am, what can I do to increase the thickness of my uterus or the thickness of the scar? As I told you, you cannot do anything. As I told you, the ultrasound is fallacious. We do not know whether it is actually measuring the scar thickness or not. So I would just say that some doctors would give you estrogen hormone, but not during pregnancy. It will be in between the pregnancies. Okay? Because estrogen is, it has been established that estrogen hormone increases the lining of the uterus. Endometrium, myometrium, it increases the blood supply. So it might be an option for a doctor to give you in case you have been diagnosed with a weak uterus, then she might give you some estrogen hormones in between the pregnancies. Last but not the least, what should you do to have a successful VBAC? Many patients, they ask me. First of all, stay healthy, eat healthy, be confirmed that you do not have any disease like diabetes, hypertension, everything should be in control. Okay, then only you can think of a normal delivery, a healthy baby. Secondly, keep a good gap between pregnancies. As I said, at least 2 years if you've had a cesarean. Even if you've had a normal delivery, give yourself 2 years for everything to settle down. Okay. Thirdly, choose a doctor and a hospital where all the facilities are available. Otherwise, you will be in a big problem. A hospital where emergency cesareans, a hospital where emergency rupture leading to hysterectomy, everything should be managed. Everything is like available there. The doctors are there, the emergency team is there, anesthetist is there, the pediatrician is there to deal to the baby, because sometimes a rupture uterus might asphyxiate the baby and the baby might be in a big trouble. Okay, so you need to choose that particular hospital where all these facilities are available. And the most important point is be relaxed and be flexible. Just watch my video, exercises during pregnancy, because unless your body is flexible enough, you will not be able to push. It will be very difficult for you to deliver normally. Okay, so these are certain salient points which you keep on asking, and I keep getting these sort of questions, so I thought I'll make a video on that. Next video will be on rupture uterus, because I've already told you rupture uterus is a separate entity. In case you have any more queries, you can always inbox me. Follow me on my channels and keep liking, keep subscribing, and keep sharing the videos. Thank you very much.